Okay, I think we can start. So, on behalf of our collaborating postgraduate programs, Healthcare Management, represented by me, Pέτρος Kostagiolas, as the Program Director, and the postgraduate course Aging and Chronic Diseases Management, represented here by our good colleague, Professor Sophie Leodopoulou of Hellenic Open University. I'm delighted and I warmly welcome you all to today's online scientific event. I would like to ask Professor Leodopoulou to say a few words on behalf of the other postgraduate program. Thank you, Sophie.
Thank you, Petros. On behalf of the director of the postgraduate program on aging and chronic diseases management, Professor Dimitras, I welcome you to this event. I have the unique privilege of being involved in both postgraduate programs that organize today's meeting, and they are united under the umbrella of health and individual aspects of it, both in terms of physical aspects of health, of mental health, of organization and management aspects. We are united in our efforts, and today we find another initiative to seek and promote scientific synergies for the investigation of health literacy. On this note, I would like Professor Kostagiolas to continue. That's from me for today so far.
Thank you very much, Sophie. Delighted to be together with the two postgraduate programs. Now, I would like to thank the head of the School of Social Sciences, Professor Prokopis Theodorίδis, for his support and welcome greeting, as well as Professor Agostinos Dimitras for his valuable contribution in the coordination of the event. Please, Professor Theodorίδis, if you want to say a few words.
Thank you.
Thank you very much for your support.
Thank you, Professor Kostagiolas. Good morning, everyone. Dear colleagues, dear students, distinguished guests, it's a great pleasure to welcome you on behalf of the School of Social Science of the Hellenic Open University to today's online scientific event. This lecture, jointly organized by the postgraduate programs in healthcare management and aging and chronic disease management, reflects our commitment to offering our students and academic community meaningful opportunities for scientific dialogue and on important social and health-related issues. Today's topic, from quality of care to health literacy, a systems approach to people-centered health, is both timely and highly relevant as it addresses quality of care, patient safety, health literacy, and the development of people-centered health systems. We are especially honored by the participation of the World Health Organization, Athens Quality of Care and Office, and I would like to warmly thank our distinguished speakers, Dr. João Breda. I'm sorry if your first name I'm not pronouncing it very well. Head of the World Health Organization, Athens Quality of Care and Patient Safety Office, Special Representative and Officer in charge, and Mrs. Constantina Vasileiou, of course, Project Officer, Quality of Care in WHO Athens Quality of Care and Patient Safety Office, for being us today together. I also thank the academic teams of the two postgraduate programs for organizing this important initiative. And also, I would like to thank all of you for your participation, and I have the pleasure of welcoming our speakers.
Thank you very much, Professor Theodorίδis. It's indeed a great honor for us to host the WHO Athens office in this event, and the head of the office, Dr. Breda, and project officer, Ms. Vasileiou. They will share valuable insights on the timely and important issue of health literacy This reflects our commitment to our students and reflects our commitment to strengthening health literacy within the wider community. Thank you all for being here. I would like to ask our students and participants in the YouTube channel that this event is transmitted to put questions in the end in the chat of the YouTube. They will be passed to us, so perhaps we have a short discussion after the talks. And I would like to thank you all for being here with us, and I wish engaging and inspiring discussion the floor to Dr. Breda, who I thank you very, very much.
Kalimera, good morning, everyone. I hope you can hear me well. The pleasure, I have to say, is all mine. It's our pleasure to receive this invitation and to be with you today. So really, greetings and express our gratitude to the university. I know you're doing a fantastic job, and we are very excited for the invite and for the opportunity to talk about our work with you and to discuss some of the priorities that we have, how we are doing this work with Greece and beyond, because we are in Athens, but we are working for the overall European region, WHO European region. And therefore, for us, it's a great opportunity, also given the topic. Health literacy is very important for quality of care. We know that it's not only about information, but how people deal with the information they receive, how they process it, and how they navigate health systems, how they take risk behaviors that are harmful or harmful to health, and maybe protective behaviors which can really help them live healthier and more. All those things which are very important require really more health literacy. We know that the levels of health literacy in many countries across the WHO European region, it's not yet where we would like to be. Greece is one of those countries. We see still a lot of misinformation and lack of knowledge about basic behaviors. For example, the negative impact of vaping and smoking in young people, and how ignorant our kids, your kids in Greece, are related with this behavior. I mean, it's really incredible. So it's just to illustrate how important this is. And then when we need to go to the doctor or to the GP or to the hospital or to the emergency room, not just in terms of health-related behaviors, but how we use the health system, this is something which is very important. And more important for those which are less educated, more vulnerable, and those things require really good plans. This is actually what we are doing here in Greece at the moment with the Greek Ministry of Health. We are working together on developing a national action plan on health literacy for Greece, simple, action-oriented, but really done in a co-creation exercise. And I thank all of you. Many of you have been involved in this process so far. And there's been a framework for its development. There's been a lot of consultation, really a bottom-up process, doing this together, co-creation. And now we're at the point where we are almost ready to take it as a draft to the Ministry of Health so that we can have a more formal consultation. And I hope that later on, before summer or after summer, we will see, we can have Greece joining this group of countries that have a good health literacy plan, because they are not the holy grail. They don't solve all the problems of the health system, obviously, but they are a very important piece of the puzzle, which we are not using as well as we could. So I think this initiative here today also gives us the opportunity to talk about it and really for us to highlight how much importance we attribute to the topic. So in our, let's say, interaction today, I would like to let you know that I will have an introductory sort of talk, presentation. I will talk about the office, what we do, our priorities, and try to illustrate that. And then Constantina will go more in depth in terms of the health literacy action plan. I will not be able to stay for the entire duration for personal reasons. Therefore, when I finish my talk, perhaps if you would like to have questions or comments, feel free. And then I will stay as much as I can, but I am afraid I cannot stay for the whole duration of the session. But I will leave you, of course, in very good hands. So if you allow me, I would like to share my presentation. I have some slides. Let me see if I can do it.
At the bottom of the screen, the share button.
Okay.
There is a share
Just a
button.
moment.
Yes, yes.
Yes, I'm there, but I need to open probably my slides. Yeah, here, let me see. Okay, it should work now. Can you see it?
Yes.
And can you see it now in full screen?
Excellent. Yes.
All right, so this is the first slide is very symbolic for us. This is our regional director, of course, and everyone knows the gentleman on the right, the Prime Minister of Greece. This is a couple of years, well, already 4 years ago almost, when we opened the office in Athens. We started working before, but we inaugurated our office in Kolonakis some years ago. And at the same time, we also launched our component on mental health. You may have heard that our office focuses on quality of care and patient safety, but we include a very strong component on the quality of mental health services, which is also very important because mental health services are very difficult in the WHO European region, and sometimes countries don't perform in terms of providing those services as well as we would like. And sometimes we even like to say, or you used to say, that mental health is the black swan of the health system. So it's really important that we also include that. So on this symbolic day in 22, we actually inaugurated the premises of the office. We launched a new program which solidified our presence in Greece. Since then, you may have heard of us in the media, social media, and I know that many of you have participated with us in some of our events. We have really been very active in Greece, but also in the, let's say, pan-European region, because WHO Europe has 53 countries we work with, and we work with most of them based in Greece. So our office is not just for Greece, although we have a relatively big component to support Greece directly, but we work for all the countries in the European, meaning that there's a lot of interaction with, of course, policymakers in the health sector, with academia, with researchers, with practitioners working on the ground, people working in primary health care, people working in hospitals. And on this second slide, you can really see an illustration that sort of summarizes some of the things we've done in 2025. Just to give you an idea, we work directly, very intensively with more than 20 countries, a lot of people engaged, many initiatives and missions in countries, lots of publications and things like that. As I said, with the focus, of course, on quality of care and patient safety. We believe that health systems performance should not be based only on making sure that people have access to healthcare, but that healthcare needs to be of better quality. And when I say better quality, it's not just in terms of my prescription, my treatment, is from prevention to long-term care. So from cradle to grave, basically. It's very important that we understand that when we talk about quality of care, we talk about a very comprehensive approach. So you can see here that our office is also a powerhouse, if I may say, in terms of scientific production, although we work mostly on, let's say, implementation research and applied research. We do work with collaborating centers and many academic institutions and others so that we build the evidence. WHO is a evidence-based organization. And because quality of care and patient safety in the European region with this, let's say, spotlight is a relatively new area, we really felt that we need to build the science and the evidence around quality of care and patient safety. Therefore, we really focus a lot on publications. And last year, we published an average of 2 scientific papers a month, and also many WHO reports, some of them really first time done globally, like the standards on quality of care of mental health services, for example. So moving forward, what we propose in terms of quality of care is really to have a comprehensive approach. And as I said, we work a lot with many countries in our region. And in this slide, you see a very varied illustration with some examples of the work that we've been done in some of these countries, trying to take a systems approach, looking at quality from a perspective of governance and the organization of the health system, but also look into aspects of innovations, data, and outcomes, focusing very much on outcomes. Can we ensure that the system is focused on the people that it's supposed to serve and on the results of the health system performance? This is really very, very important for us. So you see here a series of countries, but you also see from Malta to Latvia to Romania to Greece, we developed the first ever action plan strategy on quality of care and patient safety for Greece. Greece is now one of the 30% of countries in the WHO European region that does have a strategy on quality of care and patient safety. This was done together with the Ministry of Health, also with ODP and the health regions in Greece, and many other things. We also produce comparative analysis, like the Taking the Pulse report on quality of care and patient safety for the WHO European region, where we are not highlighting, let's say, pockets of bad performance. We are putting forward, let's say, comparisons or opportunities to see how you see yourselves compared with other countries, what are the good practices from other countries that you could propose. We produce country profiles in terms of quality of care and patient safety with a strong component as well. And we did that for the first time a couple of years ago. Strong component on the area of information, misinformation. By the way, only 1 out of 10 countries in the European region have, let's say, proper models or actions, roadmaps, action plans to deal with misinformation. And with the health literacy action plans, also only around less than 40%, I would say. So we're doing a variety of actions. A lot of them, of course, they are very much centered in Greece, but a lot of work with many countries. One other area where we are doing, and we've been doing very significant work, is on what we call capacity building. You may heard of our work around training on quality of care and patient safety. We have established the Autumn School on quality of care and patient safety, which already we have deployed 3 editions. We are now working on an edition that will be delivered for Russian-speaking countries in Tajikistan soon, in summer. We will have another one in Greece later in the year. These matters of information, and also on health literacy, obviously included. But also we have a stream of work on public health and promoting leadership skills for public health. Therefore, we have the WHO European course on public health leadership, we are already on the 7th edition. We delivered the 7th edition last week here in Athens with many public health professionals coming from all corners of Greece. And that's really something I would say quite unique. This initiative didn't exist before and is filling a very important gap in the context of the WHO European region. Also on mental health, we have an autumn school on quality of mental health services for children and adolescents, several editions, so really working with countries, improving, let's say, and increasing competences around mental health. So really one area where we focus a lot, a very important pillar of what we do, is improving literacy of health professionals themselves, leaders in public health, leaders in health, in the region, in the ministry, etc., etc. We also work very much, and here health literacy plays a very significant role, is that sometimes when we go and enter in contact with the health system, we don't always get good things. We don't always get the best treatment. We don't always come better than when we enter, let's say, the hospital or the primary care center, because we have errors, we have accidents, we have sometimes medication errors and even misidentification of the patient. 1 out of 10 contacts globally of individuals with the health system, they don't go that well. This is a matter of patient safety. This is why we really need to work also on avoiding harm in healthcare. This is why health literacy is also a very important component of these aspects. So we really try to balance all of these, the quality of care while you improve patient safety. We have, of course, a strategy in Greece, as I said before. This really interconnects very well with the global action plan on patient safety, of which, of course, Greece is a signatory and where we're trying to improve work there. I talked to you about our work on mental health. We work with more than 12 of countries directly. We've been able to deliver very significant tools, which are available, of course, for Greece, and we developed many of them with the support of great Greek experts and NGOs, and of course also the Ministry of Health. And some of the things we've done, I would highlight from these 4, let's say, pieces of work: publications and tools, the quality and standards for child and youth mental health services. The third tool on your slide is unique globally. It's the first time that this has been done, particularly in the European region of WHO, and it's like a roadmap. It's like, I would say, if you allow me, the Bible to implement really mental health services to serve children and adolescents. They were entirely developed, everything you see here, with a health literacy focus and with the collaboration of young people living with mental health conditions. We even pay them as consultants to be part of our work in this area. So we don't forget about mental health. Mental health is normally forgotten, and we can't allow that to happen. Soon we will be launching our clinical audit, so follow us on Facebook and LinkedIn, and you will see the launch event is also going to be online, and we will have an event at the Ministry of Health. So many things happening soon in the field of mental health, which we would very much be honored if you would like and you could join. Working, of course, supporting many countries. Greece is the country we work more on mental health of young people, of course, but also with others. And here I just bring 3 illustrations: Albania, Latvia, and Greece, but I just came from Lithuania beginning of the week, where we are doing more. And as I said, we have more than 12 countries where we work very closely. Now, for Greece, One of the areas where we've been doing a lot of work is on improving quality of data for quality of care and patient safety. We have a unique project called Health IQ. It's about improving, it's about putting all the data that exists together in Greece from different sources, IDICA, ODP, AOP, AOD, whatever you think about in terms of quality data. We are handling more than 190 indicators, putting everything together. It will be available soon for everyone to have a look, starting with the leadership of the ministry and then in the regions. And really a lot of work. Greece is leading the way in Europe in terms of a very significant tool that you didn't have before. And by working together here, the different health authorities, the health regions, the different health institutions, and the Ministry of Health, I think we're making great strides in Greece, where we will have information, high quality, really on time. Next steps will be to incorporate AI into all of this process. Another massive initiative undertaking is the 3PH. It's a project that brings together public health and primary health care, and where we're supporting the health regions and also again working with the Ministry of Health in terms of supporting the different reforms and upgrades in the primary health care networks and in the institutions in Greece, all across Greece. And really one of the areas we are creating added value is on the training and capacity building, very significant, on the building networks, working with people on the ground. And here you have some illustrations of what we've been doing. We also develop a roadmap that is now being provided to the Ministry of Health in terms of how we see further improvement in the years to come. Just a very nice tool that perhaps you would like to have your hands on. We will have a Greek version very soon being launched, which is the primary healthcare pocket book for children and adolescents, and that every single professional in Greece working in primary care should have. You will have one for you at least in Greece, in Greek, very soon. I talked about, again, the public health leadership courses. So here you see an illustration of those. We started in Rome, then in Bordeaux, then in Kiev, in Ukraine, in Astana, in Lisbon. In Greece, we already did 2 editions, one in 25, and as I said, we just finalized the 7th one here last week in Athens. And of course, a lot of work around innovation, particularly with data, also engaging AI. I don't want to go into too much detail, but this is a very significant part of our work. So I hope this was useful to illustrate what we are doing here together with the Greek, not just the Ministry of Health, but the Greek health regions, a very wide and large and high quality academia. And many of you, we are grateful for the support that you are providing to WHO, but also to your country through WHO. And we are very keen, excited, delighted to work together. Thank you very much. If you have any questions, comments, please let me know. I'm going to stop sharing.
Well, thank you very, very much for sharing this fantastic effort and initiatives with us through this event. The dissemination is absolutely necessary, and I think we are all on the same page. So we will advocate the programs to our students and the academic community. So thank you very, very much. Now, I don't know if we have any questions from the YouTube channel past here. However, I don't know if we have a lot of information that has been shared, so it will be available. So, Dr. Breda, let's say that we stay in touch as academic community, Open University, and other academic institutions in Greece. And we wish you wholeheartedly strength and health for your next fantastic initiatives involving the European region and Greece in particular. Thank you very much for being here and sharing all the information with us. And we move with...
My great pleasure, just to say, we are here for you. Please reach out. It's amazing to work together. We're doing really great things together, and I'm very grateful for the invitation. And any questions, Constantina will share the slides with you. Feel free to contact us. I will stay around a bit more as much as I can. Thank you
Fantastic.
so much.
Thank you very much. Thank you so much.
Thank you.
So the floor goes to Constantina, Miss Vasileiou, who I would like to thank very much for her participation. And she will talk about health literacy. The floor is yours, Constantina.
Thank you, Pέτros, and thank you for this honorable invitation. It's also my pleasure to be here with you and to engage with the students community. And we hope that this sharing of our work will be helpful, and will start a dialogue on this important topic on health literacy. So I will share my slides, and let me know if you can see my screen. Can you see it?
Not yet.
Not yet.
Not yet.
Yeah, I think now we can see the screen. It arrived.
Great. So it's in presentation mode, I guess.
Thank you. Yes.
Okay, thank you very much. So I will dive, as João mentioned, a bit more in depth on what is health literacy and how we do policy in health literacy. So I will start with the main question: what exactly is health literacy? So according to the WHO definition on health literacy, it is the ability of a person to find, meaning to access, obtain, or search health information, but also to understand this obtained information and be able to appraise, process, and assess the information received, so that the person can make use of this acquired information in order to make informed decisions to sustain or improve their health. WHO in 2013 introduced the relational concept of health literacy through the integrative framework on health literacy, which actually shows that health literacy is shaped both by personal and individual health literacy competencies, but also it is shaped by environmental factors. And with that, we mean the demands and complexities of the systems that the people live and act. So this is very well illustrated in a later definition of health literacy by the MPOL network, which is the WHO Action Network on Measurement of Population and Organizational Health Literacy, which is here in the slide. And it says that health literacy is influenced by social, cultural, and organizational contexts in which people grow up, learn, work, live, receive care, and age. And it results from the interaction between personal motivation and individual competencies, but also it depends on the accessibility, understandability, quality, and user friendliness of health-related information and services, and the support that it is available to address health challenges. And here we can see in this table, in this picture, which comes from the Portuguese Health Literacy Action Plan, the previous one, the last that it is published, the health literacy through the life course, and we can see that health literacy starts from childhood and goes through youth age and adulthood and the elderly years. And actually here it's well represented the link with different healthcare functions and how we shift from health promotion, the balances shifts from health promotion to healthcare through the age. And for this, on this we will talk later in the presentation more. So there are many different health literacy types. And here we have chosen some of them to give a good illustration of what is the main what are the main types that can describe health literacy. So one part is the personal health literacy, which are types that come from the early literature, and these include the functional, interactive, and critical health literacy, meaning the basic reading, writing, and numerical skills that enable individuals to function effectively in everyday situations and understand health information. Interactive health literacy is more advanced cognitive and social skills that allow individuals to actively engage with health information and extract meaning from the different forms of communications with health professionals. Critical health literacy, which is an even more advanced cognitive and social skills that critically enable individuals to critically analyze information, understand the social determinants of health, and take individual and collective action to have a better control over personal and community health. Then we have the distributed health literacy, which is a more recent identified health literacy type. And this type reflects the sharing and use of health literacy across a person's social network, meaning families, friends, caregivers, and professionals that contribute to understanding, accessing, and using health information. And it is a more system-oriented perspective. And then we have the cultural and content health literacy, which is understanding how culture and beliefs and language affect health behaviors, communication, and decision-making in health. And not all health knowledge comes from formal systems, but also lived experience matters a lot, and it affects how people judge and use health information. Then we have the digital health literacy, which is a very prominent health literacy type, and it describes the ability of the person to seek and find and understand the information from electronic sources and apply the knowledge gained to addressing or solving a health problem. And it combines the traditional literacy with information on media and computer literacies in the digital environment. The mental health literacy, which is the ability of a person to recognize specific mental health conditions, knowledge of risk factors and causes, knowledge of health, self-help and professional treatments, and knowledge of how to seek mental health information and attitudes that promote appropriate help seeking. And then we have the organizational health literacy, which shifts from individual to the institutional level health literacy and focuses on the degree to which organizations enable individuals to find, understand, and use information on health-related decisions. So it involves designing health services that are easy to navigate and use. And here we can see the link of health literacy with information seeking. And we have some results of low health literacy in the information seeking, where people with low health literacy have difficulty in identifying credible sources. It results in greater susceptibility to emotional and sensational content. It results in overestimation of rare side effects, and it reduces the confidence in navigating health systems, and of course it overall reduces the trust in health systems. And on the other hand, high levels of health literacy results in greater trust in healthcare professionals, better evaluation of scientific evidence, stronger resistance to misinformation, which is very important, as João mentioned earlier, and improved risk-benefit assessment and high engagement in preventive care. So the pathway from low health literacy leads to uncertainty and fear, while high levels of health literacy can have totally different behavior. So why it matters? Here we can see in a more comprehensive way the effects of health literacy. It affects health behaviors from prevention behaviors, adherence in treatments, self-management, and treatment of disease, decision-making in health matters, the navigation in healthcare systems, the meaningful engagement of population in the health system, quality of care, and overall health outcomes and the trust in health systems. It has been estimated that up to 3 or 5% of healthcare costs are linked to poor health literacy. And this particularly, it is linked to increased use of emergency care and avoidable admissions. So investment in health literacy results in appropriate service utilization over the life course, health equity, people empowerment, and healthier adults. And this is the reason that it is a global priority, which we can see it in many different mandates, in Shanghai Declaration, the Sustainable Development Goals, the Global Health Strategy from WHO, the EPW2, the European Programme of Work, and the General Programme of Work of WHO. And let's see some data from health literacy, for health literacy in Greece. The population level of health literacy had been only measured back in 2011 at the HLS EU survey, where we have findings that from the greater Attica region, that almost 44.8% of Greeks have limited health literacy. And more recent data show that 43.7% cannot understand health materials. 58.4% they are not informed on treatment alternatives, because which is related to consent. And these results, of course, have a higher impact on vulnerable populations after over 65 years old, and with chronic conditions and low socioeconomic status. Also, the digital health literacy gaps have been identified, which are linked to increased inequalities. Mental health literacy is also linked to low awareness, stigma, and access barriers. While oral health literacy has been identified as estimated in moderate levels for Greece. In children, 36% of children have low health literacy, which is linked to higher BMI, and adolescents have insufficient knowledge, with boys more affected. At the system level, there is limited health literacy integration in the healthcare system, and low professional familiarization of the healthcare workers with the idea of health literacy, and limited patient involvement in policies when it comes to health. But regardless of this data, we do have a policy momentum. We have the recent National Quality of Care Strategy that for 25 to 30 that includes health literacy in one of the main pillars, and the development of the National Health Literacy Action Plan. We also very, very recently, in 2026, had a very good development that Greece joined the EMPOL network as a country member. So we will have the opportunity to have new data on the population levels of health literacy, the general health literacy, and other types of health literacy that are measured within the EMPOL survey. And we also have an established Hellenic Scientific Society for Health Literacy, which is also very good for the academia and scientific community. And here, just some results, more recent results from the AHLS survey of the EMPOL in 2019. At the European region, we see that 55% of the population have sufficient or excellent levels of health literacy, but 46% still have problematic health literacy. And this is linked as well with the social and socioeconomic status and inequalities. So, as we move health literacy in evolving health systems, it is suggested a new whole system perspective on health literacy capacity building, and here we have a diagram from suggested by Christine Sorensen on how to build the health literacy system capacity, and some major components that are suggested for people-centered services that enable health literacy system, leadership, funding, of course, the support of technology and innovation, health literate workforce and organizations, and governance, data governance, which are very important to embed health literacy in the systems. So, moving to reframing health literacy policy development specifically, the current approaches that have been developed through models and framework on health literacy are more limited in national settings. They are more explanatory and conceptual models, and focus on the macro level, meaning the population level, the individual level, and they are static and focus on educational only activities, and with weak system integration and translation to policy. So what is needed? What is needed for a new way of policy development is health literacy, is to embed it in the national policies and to integrate both the clinical and the public health approach of health literacy, multi-level system-wide actions, and responsiveness to complex individual and environmental determinants, and to suggest implementable, feasible policies. On this end, our office has worked on the development of a new framework on policy development for health literacy, the concentric health literacy policy development, which aims to an integrative, relational, dynamic, and system-wide model. which introduces multiple analytical angles to inform health literacy policy development. And it introduces 7 different lenses. This work has been recently developed in a working group, and we are very grateful for the collaboration of national and international experts on this work. And based on this, we would like to also develop the Health Literacy Action Plan. So just a few words on the framework's description and explanation and the lenses. We see the core lens is, of course, the health literacy competencies: access, understand, apply, and appraise and apply health literacy information in order to make health information in order to make informed decisions and navigate health systems. The second lens are the types of health literacy: the personal, distributed, and organizational health literacy, which we have identified as the core health literacy types that move to the next lens, which includes the health literacy, the health context and content, where health literacy shows that it depends on. So this content and context varies with the health, with the type of health information involved, and the health situation in which people need to understand and use it. So this means that people may navigate some health topics easily, but struggle in other topics like complex treatment decisions, and that their abilities change across settings such as clinical care, prevention, or everyday life. And it depends on cultural and contextual backgrounds. So some examples here are mental physical health, cultural health literacy, navigational health literacy. And I think that this list is of course is not exhaustive, and it never ends. So this moves to the next lens, which includes the 3 healthcare functions: health promotion, health disease prevention, and healthcare. So health promotion represents the broadest domain where health literacy is manifested in different contexts and life situations, as the ability to engage with social determinants of health and to take action that supports well-being. Then disease prevention is when health literacy becomes visible in how individuals engage with information about risk factors, screening, and early detection. And here people access and interpret information about the health risks and vaccinations and behavior change. And then we have the healthcare function, where health literacy is manifested through people's ability to navigate the health systems and engage in interactions with professionals. So what changes is the context in which these competencies, the access, understand, appraise, and apply health information are enacted. So from clinical care to risk management and to broader societal engagement. So this perspective highlights that strengthening health literacy requires both enhancing the individual capacities and transforming systems to more accessible, responsive, and empowering systems. And then we have the outer lens, which is the micro, meso, and macro policy levels, which target the micro level describes the interactions and skills at the individual and interpersonal level within the direct care and immediate social contexts. Individual levels are skills and motivations, and interpersonal levels are patient and healthcare professional communication and support networks. The meso level reflects the organizational health literacy and services and responsiveness of the facilities, and it reflects the organizational governance, environment, workforce capacity, and the culture of the organization. And also the macro level is the broader societal, civic, and policy structures that shape the collective engagement. And it's also the governance, regulatory, and structural systems that shape the health ecosystem. So this framework supports the development of health literacy across the three levels, shifting from the individual to a more system-wide approach. The next lens is the determinants of health, which provides the structural context where all these lenses operate, and it includes the social and economic determinants, the physical, individual, and behavioral determinants of health. And these also reflect digital, commercial determinants and shape the access to information, resources, and opportunity, but also behaviors. And of course, it is linked to inequalities. And the outer lens is the life course, where different stages of life cycle, from conception to aging, family relationships, peer groups, and community, shall be considered as playing a key role in the process of health literacy promotion. Here we have an example of cancer control on how we can implement this framework. On people's competencies, on organizational health literacy, and lens national cancer control plans, and how the broader determinants can also affect this process. I will not dive more into this. You will receive the slides for your reference. And based on this framework, we will draft and design the health literacy action plan, the first health literacy action plan for Greece. Our goal is to move this number to 70% of health literacy levels at the population, and for sufficient and excellent health literacy by 2031, and strengthen the individual capacity and the system responsiveness. The values, we have identified some values that we will rely this suggested action plan and activities. And the process is evidence-based. It has a part on literature and desk reviews and situation analysis, but also it's a participatory and co-creation exercise, including regional workshops with all the healthcare regions and health workers throughout the country, consultations with key stakeholders, and of course, including a strong component that includes the patient's input with the Greek Patient Association. And we will be happy to share more in the near future for this action plan as we move on. And I will leave you with a lighter slide on children. We had the pleasure last year in September during the World Patient Safety Day to have an event at Syntagma for children, where we launched the adaptation of patient safety books for children, which is a relevant activity to enhance health literacy for children, which was, of course, in collaboration with the World Patients Alliance that they had originally developed this work, and it is a very nice material for children's information on several topics that are interesting. Thank you very much for your attention. I hope that this was helpful and illustrates in a way some angles of health literacy and policy development, but also our work. And thank you very much. If you have questions, I'm here to reply. Thank you.
Well, thank you very, very much, Constantina, for the dense, fantastic presentation. giving us a lot of food for thoughts academically, research-wise, and I'm sure that this sharing all these ideas is a first step for many of us, let's say in the community. These ideas are quite new, so they need to be visible within our professional thoughts, our academic thoughts, and there are lots of opportunities to interact and to be part of this health literacy, let's say, concept, which is fantastic. Now, as far as questions that have been stated in the YouTube channel, we have few that can be, let's say, merged into one big, let's say, question, saying that how, as professionals, as students, how we can be informed about all these initiatives and these actions. This is the question that comes from YouTube, and a lot of notes for thank you. So how can our, let's say, the audience, the people, that the community can be follow all these developments through the website of who?
Yes. We will soon have publications, and of course we share in our social media. We have a Facebook account on the WHO country office. We also have a LinkedIn profile and Instagram profile, and WHO of course has the same profiles for the regional office. So of course we will we share all our work through these channels, and we also have our contacts in case anyone would like to have more information.
Okay, thank you very much. A few thanks are arriving, and one more question has arrived. So I give priority to our students and people who follow this presentation online. Now the question is that as patients increasingly turn to AI for health information, how do you see this in relation to health literacy? Is it a risk for misinformation, perhaps a new challenge?
It's both an opportunity and a challenge. So it has to be very carefully addressed, and of course all this new technology that runs so fast in this space, sometimes we're not able to follow the developments, and we run after in order to be able to ensure that we have a safe utilization of this technology. But for sure, we could leverage this opportunity. But on the other hand, misinformation is critical, and health literacy is also critical to train people in order to be able to have a critical thought towards health seeking, information health seeking. And misinformation, I think, as João mentioned, is something that should be brought up in the agendas of countries for strategies and policies to ensure a safe information seeking.
Thank you very, very much. Now, I think that you may allow a short closing statement, perhaps from Professor Londopoulou, from the viewpoint of both actually postgraduate courses, and a very short closing statement on my side. And I would like to thank you very much for your presentation. Sophie?
Thank you. It was a phenomenal presentation, both yours and João Breda's presentation. Thank you very much. It was very interesting and an eye-opening experience as to the richness of what has been going on and to the potential that this unleashes. Actually, I had a question around AI. I think, though it was somehow addressed, my focus would be actually on the decision making in terms of mental health decisions for treatment or for seeking counsel or whatever it's needed. And the same question could be addressed for the aging population and also for the people who suffer from chronic diseases, because if AI is already there, although we are not all embracing it at the same time, however, it has significant inequalities, as you have already mentioned. How can we make sure that this critical aspect of things is addressed or will be addressed in the future? Thank you.
Thank you very much for your kind words. For this interesting question, of course, this gives the aspect of vulnerable populations and inequalities that have to be always addressed throughout the policies, because in all data that we see, this part of the population has the most problematic results, let's say, at the levels of health literacy. So all policies should target particularly in these focus groups, and policies should prioritize the training the people on information seeking, as I mentioned earlier, but also through the healthcare system, but also the communities. In a more public health perspective, in order they should utilize opportunities to help people navigate information, but also make use of the new technologies and have ways to support them when needed in decision making, for their health, for the self-management when it comes to chronic diseases. And I think being close to having a more people-centered, in the end, more people-centered care is the answer in all these issues. I hope this answers your question. Thank you.
Thank you. It's a process, I realize, but things have to be recognized in terms of policy making, but also in terms of practical applications. Thank you.
Well, thank you very, very much, Constantina, for the presentation. I am standing between you and the rest of the afternoon, Saturday afternoon, so I will not keep you long. I state that I share the same ideas. I would like to thank you for the collaboration in MPOL and the honor to be part of the expert group in the framework. Thank you for this presentation here. Looking forward for further research and documented policies for Greece as well, which is a very important issue, health literacy, with many different dimensions, as has been fantastically explained. It's also about equity and about democracy. So sharing these ideas, I would like to thank you very, very much for this presentation, and the head of the Athens office, who gave us an overview of all the actions and initiatives. Been honored to have you here with us in the Open University. Thank you very much.
Thank you very much again for the honorable invitation. It was a pleasure, and I hope this discussion was a starting point to inspire more people and students and new professionals to be closer to this way of thinking, because after all, health literacy is for population.
So thank you very, very much. This is the closing. Wishes for a fantastic weekend and good experiences in our postgraduate courses at Open University, Hellenic Open University. Thank you very much.